I just wanted your commitment to continuing that conversation as we work to make sure that we use hard-earned taxpayer dollars wisely and efficiently, and we also make sure that we have life-saving and life-changing research that continues.
Yes, Senator, and based upon some of our conversations and conversations that I've continued to have, expressing your concerns, particularly for the state schools that do not have endowments and that really need lab support and need gloves and test tubes and mass spectrometers and all of the things that you need to do first-class science. We want to be paying for that.
Good. Thank you so much.
And we figured out devices in which we can do that, but not through the indirect cost mechanism.
Well, thank you so much. I look forward to continuing that conversation with you. I also want to thank you as a mom. So out of all of the different secretaries that we voted on and confirmed, I think my friends were most excited about you because they thought for once they had someone that was willing to take on, whether it's big companies or big tech in the name of health for their children. When it comes to social media, that's something as a mom of a 15 and a 16-year-old that I get to see the effects of firsthand, not just in my own home, but with my friends and things that are happening in the community. I wanted to talk with you a little bit about that. We've seen the rate of depression amongst young people more than double. We've seen 1 in 3 high school young women actually consider death by suicide. If you look at those same numbers, 25% of those actually made a plan to take her own life. And then you had 13% of high school young women actually attempt death by suicide. We saw the Surgeon General come out and say there needs to be warning labels on social media. People need to know about the mental health challenges that can occur from use, persistency, and that. Just want your commitment that you, obviously, as you take on toxins in the air, things that are in the environment, things that are in our food, that we'll also look at the things that are in our children's hands and how we can do better to put up guardrails to allow them to continue to explore, but to do it in a safer manner.
Yeah, absolutely. And I want to thank you for your support, Senator. I had a conversation with 2 of my grandchildren this weekend, and somebody used the word, one of them used the word anxiety, a 5-year-old boy. And I was thinking that I didn't know what that word was probably until I was a teenager. I never heard anybody use it. But today it is part of the vernacular in young people. And why is this happening? Why are our kids anxious and fearful and depressed and suicidal? Our black children in this country, suicide is now the #1 cause of death. On the Indian reservations, it's now the #1 cause of death. And why are we having this epidemic of loneliness, of alienation? And some of it may be social media, and we're looking into that, and that's part of our portfolio. Yep. But a lot of it may be coming from our food, and we know that the food we now understand that food disrupts microbiome, and it causes these mood swings and anxiety, and we need to look at those.
Well, and I'd love an opportunity to work with you on that, and I know I'm running out of time. We have people that are concerned about Head Start. The news has, taken a narrative that I believe is untrue. I know that you care about the most vulnerable children. I know you care about making sure that those children have access to educational opportunities and care. And could you just speak directly to those families and providers about what this administration's plan for supporting and sustaining Head Start in FY26 and how you're working to provide them with the stability that they need to serve those vulnerable children as well?
I'm very grateful to Russell Vought. I told him how important Head Start was to me. My uncle, Sarge Shriver, started the program. There's 800,000 of the poorest kids in this country who are served by that program. It not only teaches the kids, preschool skills, reading, writing, and arithmetic before they get to prepare them for schools, but it also teaches the parents, and it teaches them how to be good parents. And we see that the children who are exposed to those programs have less contact with law enforcement later in life. They're more likely to graduate from high school and college. They're more likely to hold down jobs. There's a lot of problems with Head Start. We've kept it fully funded, and I'm very grateful to Russell Vought for that and to the president. But there's things we need to correct. One is the food that they're serving at Head Start is terrible. We need to change that. We're poisoning kids, from the poorest kids, from their youngest years, and we're going to change that. And then there's other issues, too, that need to be corrected. But we're going to have a better and brighter head start by the end of this administration.
Well, I look forward to working with you on that, so many other issues, and also the wage index issue that is really hurting Alabama and our rural communities and hospitals. So look forward to continuing our good work together.
Thank you, Senator.
Senator Rounds.
Thank you, Madam Chair. Mr. Secretary, welcome.
Hey, Senator Rounds.
Long day already. Let me go through a couple of items that, if I could, please, and I know you've heard a number of questions in terms of where things are going. Let me share with you one that I think we may need some help from you specifically on. President Trump issued an executive order to boost the American mineral production. He did that on March 20th. The National Institute for Occupational Safety and Health, or NIOSH, mining program supports this goal by funding research at the nation's 14 accredited mining schools, including the South Dakota School of Mines and Technology in Rapid City. This includes support for critical work in metallurgy and mineral processing, fields where the Black Hills region has been a national leader. However, my office has learned that staff at NIOSH's Spokane Mining Research Division have been laid off. This office focuses on the unique challenges of Western mining, operations that are often more geologically complex and exposed to harsher conditions. This division provides critical technical support for institutions like the South Dakota School of Mines and Technology, which recently received a $1.25 million grant to improve underground mining safety. However, the grant has now been canceled due to loss of oversight from the Spokane office. This is not just a missed opportunity. It undermines our ability to meet national security goals tied to mineral independence and supply chain resilience. Mr. Secretary, given the President's directive to increase American mineral production and the clear role that NIOSH plays in supporting research at accredited mining schools, can you help with regard to why, or can you explain, or are you aware that the Spokane Mining and Research Division basically has been shuttered? And how does this work in terms of how do we get that research done, particularly with Western mining? And this is one in which clearly the President wants us to focus with creating a supply chain within the United States.
Senator, I was able to bring back 328 NIOSH workers, mainly for soft mining, soft rock mining, coal mining in Cleveland and Morgantown. And to reinstate some of those other jobs, I will work with you. I've spent a lot of time, as you know, in your state. I've been many friends who are working at the mine up in Deadwood and Leeds, South Dakota. I've been myself to the bottom of that mine many times. I understand the health concerns and how brave you have to be to undertake that kind of work. We need to protect our miners. We need to protect them because they are the future of our country.
You would work with us to find a path
I want to
forward.
work with you on that, and I hope you'll contact my office.
Absolutely, Mr. Secretary. I'd be happy to, and just wanted to bring it up because this is one that we need to get fixed. So I appreciate your looking into it. Also, since 1995, NIH has invested nearly $1 trillion into U.S. biomedical research. In 2021, the Biden administration updated NIH's data management and sharing policy to promote greater transparency and accessibility, yet much of the research data remains siloed, inaccessible, or trapped in outdated formats, making it difficult and costly for innovators to use. This limits the impact of taxpayer-funded discoveries. To address this, I've sponsored the GUIDE Act with Senator Heinrich to modernize federal data systems, making sure that they are AI-ready and accessible for responsible innovation. Secretary Kennedy, what are the main barriers, technical or institutional, preventing NIH from creating clean, modern, accessible data sets that drive discovery and innovation?
One of the most exciting things that I'm most excited about in running this agency is the opportunity, the unique opportunity we have now to update those computer systems to crush down those silos, which we are doing. And a lot of that is just bureaucratic inertia. And what we found is a lot of, I actually learned that in order to get access to CMS data, for another one of my agencies that wanted to study that data for healthcare purposes. We had to buy it from another agency there, so they're hoarding the data and they're selling it. It makes no sense, and we are bashing down all of those barriers. And we're going to digitalize our data, we're going to depersonalize it, we're going to put it on AI, and we're going to make it public through data sharing agreements that allow people all over the country to access it and take advantage of it.
Let me throw you one.
And I look forward to that legislation because I want to say this. We have been able to recruit the top minds in Silicon Valley to come into the agency, people who've walked away from billion-dollar corporations, not because they want prestige or they want position. They are there because they want to transform the agency by making it AI friendly. I spent yesterday all day talking with the innovators from private industry about how to get them that kind of data. So it's a huge priority for me, and I look forward to working with you on it.
Mr. Secretary, thank you. And my time has expired, but with permission of the chair, I need to offer one softball question for you. The combination of biomedical research in coordination with AI in terms of speeding up the processing and so forth tells us that we can make discoveries and cures for some of the main dread diseases that afflict mankind today. And we can do it within a very short time period, which not only would save federal taxpayer dollars in terms of long-term treatment, but also improve the quality of life for millions of Americans and families throughout the world. Would you agree that the combination of biomedical research with artificial intelligence accelerating that discovery process could very well improve the quality of life for millions of Americans?
It's already happening at FDA. And, I had a conversation with Marty McGarry last week, or even the initial introductions that we're making with AI have already quickened the clinical trial process. So, I can't even imagine the kind of opportunities that we're going to get from this, from transitioning to AI and marrying that with biomedical research.
Thank you, Mr. Chair. Thank you, Mr. Secretary. Thank you, Madam Chair.
Thank you. Senator Merkley.
Thank you very much, Madam Chair, and good to see you, Mr. Secretary. And I wanted to address a topic that I think you and I may have similar thoughts on, perhaps the President has similar thoughts on, and that is real concern about the high cost of medicines in the United States of America. Back in October of 2018, President Trump, in his first term, noted that it's not acceptable that Americans are charged more than others in the developed world, and that we should be the most favored nation. My team connected with the White House team to say I had a bill and to end the gouging of Americans on drugs, saying that they couldn't charge us more than the average price that was charged in Canada, Australia, Japan, and a group of the larger European nations. It seems just clear to me that given the taxpayers of the United States put more into the R&D of these drugs than any other citizens anywhere in the world, we should at least get the fairest price, not the worst price. And I believe that I read comments by you that supported that general notion.
Absolutely, and I told one of the senators, I don't know if the bill that you're talking about is the same bill that I talked to Senator Sanders about last week, but it's something that we're very excited about. The president announced a EO on most favored nation status last week, and I was present for that and helped craft the EO. And we are already in negotiation with the drug companies to discern the ways that they're going to comply with it. So it's something the president is committed to. I'm committed to. Why do we spend it? Why can an American fly to London and buy Ozempic for $88 a dose? And from the same factory in New Jersey, in the same package from New Jersey that he buys in New York City, or at a list price for $1,300.
Thank you. No, it's outrageous, and The difference, Senator Sanders is a sponsor of my bill and Price Gouging for Medications Act. The difference between his bill and mine is that I should say we should get the lowest price at which those companies are selling it to those major countries. His bill says the average price, but it's a slightly different set, but it's essentially the same concept. You offered to work with Senator Sanders toward his bill, but can you extend that same to the group of folks behind my bill and or any bill that accomplishes this?
Absolutely, Senator.
Thank you.
You have my enthusiastic partnership in that.
I look forward to really working with you, and I know President Trump has again expressed, you mentioned the EO. The EO kind of summons the pharmaceutical companies to negotiation. I hope the negotiation, if it doesn't produce substantial results, and by the way, I'm saying it should be negotiated for everyone, not just Medicare, not just Medicaid. Like no one in America should have to pay more than what we pay. And I think that's the general sense that you have, is not just if you're over 65, you should get a fair price. Everyone should get a fair price.
That is our position, too.
Yes, thank you. I wanted to turn to the reconciliation bill, and I apologize. Maybe this has been covered while I was over in foreign affairs, but I wanted to understand express my concerns about the possibility of nearly 14 million Americans losing coverage. The bill, as it hasn't come out of the House yet, but is administration trying to work to get the version that came through the Rules Committee and the ENC Committee modified so that we do not lose Medicaid coverage?
Well, I think there's two issues. One is for Obamacare, and the other, which is that 13 million that you're talking about. The numbers that we're looking at are 8.5 million on the Medicaid, and the Medicaid, Obamacare is a little different, and that's the issue of the extension of the tax credits. The Medicaid is the cuts there are not really cuts; they're basically cuts in the growth of the program. And those cuts are to eliminate waste, fraud, and abuse. And I don't want to just use those words. And I talked about this a little before. There's 1 million people that we've been able to identify that are collecting Medicaid in 2 different states, which is illegal. There's 1 million people that are collecting Medicaid and Obamacare, which is illegal. There's 1 million illegal aliens who are collecting Medicaid, and they will be eliminated. The remaining people are all people who are able-bodied, who do not want to meet the minimal standards that President Trump is establishing, that they either have a job, they have a part-time job, they're looking for work, or they're getting an education.
So I hear your arguments. I have seen evaluations of this program that consider it to go far beyond just that sort of, I support the waste, fraud, and abuse of people double enrolled in various programs. But one of the things, for example, is we had a government efficiency so people could enroll in SNAP and Medicaid at the same time. That's being severed, which makes it, if you're a single parent, you're raising a couple kids, you're working 2 or 3 jobs or minimum wage jobs, and at the same time you have to go in every 6 months and revalidate your income, apply for 2 separate programs. I mean, the reality is it's extraordinarily different for ordinary struggling families to do that. And the goal is to cut down the number of people by making it difficult. And I don't think we should make it difficult for folks who are trying to be on their feet and raise kids. I wanted to note that the loss of people enrolled in Medicaid, and I consider health care a right, not something that is you achieve because you're wealthy enough to buy it. I think every developed country but the U.S. has said health care is fundamental to a thriving population. So they strive to make sure everyone can have access rather than trying to create obstacles to access. So I'm concerned about this obstacles to access approach. But where I'm really hearing from are our rural health care clinics and our hospitals, because they are on the edge right now, and they are shutting down birthing centers. They did so in Baker. I have a picture of your father when he was in Baker well, during his presidential campaign. And so now people have to go down in eastern Oregon where there's horrific winter storms, an hour to get to a birthing facility, or more than an hour. Anyway, I'm concerned about these rural clinics and hospitals that are on the edge going to be shut down when a lot of people won't be able to pay.
If I could interject here, sorry, Senator.
Am I over time?
Yeah, you're over time.
such
And
an
Senator Bo's
important topic.
been here the whole time, and
I
the
talked a
Secretary's
little
up
bit about it
against
before.
a
commitment to those hospitals.
a hard
I'm
stop.
happy to talk to you. I appreciate that your civility in here today, and I'm very, very anxious. I agree with you on all the issues that you talked about. If you call my office and want to talk about it, I would
Great.
like to.
I will absolutely follow up. Thank you very much.
Okay, Senator.
Thank you, Madam Chair and Ranking Member, again for having this important hearing. Thank you, Mr. Secretary, for being here. Cancer remains one of the leading causes of death in the U.S., as you know, and early detection through screening is critical to improve outcomes, reducing long-term health care costs. The national...
I didn't hear what you said.
I said that early detection through screening of cancer
Cancer,
is
okay.
critical to improving outcomes and reducing long-term health care costs. I'll try not to mumble. So, National Cancer Institutes are designated cancer centers that deliver cutting-edge cancer treatments to patients in communities across the United States. Yet there are no NCI-designated cancer centers in Arkansas, Mississippi, or Louisiana, states with some of the highest cancer mortality rates in the country. Arkansas has been working really hard on that designation for the last several years. We know that strong federal partnerships are essential. We really would like your help as we go forward with that, again, in providing this ability. How can we help HHS prioritize investment in prevention, screening, and infrastructure, particularly in rural regions, to improve cancer outcomes? You know, you talked earlier about what can we do to, really get a handle on, certainly nutrition is important, but again, besides that, as we go forward.
We need cancer treatment, and I'm aware of the application by the University of Arkansas to get an NCI designation, and I'm very anxious to help you with that.
Good. Thank you very much. As chairman of that committee, I appreciated your comments last week in the House recognizing the difficult position our farmers are in. I'm concerned that rural America is struggling, especially our farmers. Nearly half of Arkansas's counties lost population between 2022 and 23. That would be true of most of our rural counties in America. Farmers and rural Americans often face barriers to accessing health care, and including provider shortages and transportation challenges. Providers in rural communities struggle to keep the doors open, leading to gaps in care. Programs like the Rural Residency Planning and Development Program will be especially effective in helping train and retain physicians in underserved rural areas. We're in the process now of working on a farm bill, doing some things to support not only the farmer, but rural America in general. How can we partner with you? How can we partner with the HHS to develop sustainable health infrastructure that ensure that federal policies help attract and retain providers in healthcare deserts?
We have a number of programs under HRSA that are intended to do just that. One of them is the 340B program, which is very controversial. It's now under litigation. But we understand the importance of that program to rural hospitals. The GME program, which is designed to get providers, badly needed providers, into those regions. I would also stress that we're about to see a revolution in AI, and AI, I had a showcase of an AI nurse yesterday, which is just an extraordinary innovation that could revolutionize health delivery in rural areas. We met with companies that are building apps that are now used by millions of people that give direct access to health records and give transparency and the ability for people to immediately discern, and wearables also, give the capacity for people immediately to discern which direction they're going in on a whole parade of metrics, and allow you to, even as you eat food, to in real time evaluate what it's doing to your body and to take control of health. And I think in rural areas, particularly those areas that don't have access to hospitals, that it's going to revolutionize. I'm very excited about that as an innovation that can transform rural health care. But I also understand we got to keep those institutions in those regions because they're important economic drivers. And for people who really do need to visit an urgent care or an emergency room, they're life-saving. So I want to work with you and do everything that I can. And the other senators, both Democrats and Republicans, want to make sure that the 60 million Americans who live in rural areas have, and who are critical to our culture, to our economy, to our history, and to every other value, that it's critical to keep them in those areas and healthy.
Thank you very much. Thank you, Madam.
Thank you, Mr. Secretary. I know you have a hard stop at noon, but we've got one more question here. Senator Schatz, and then we will wrap up very quickly. Thank you.
Thank you, Chair. Thank you, Secretary, for the extra 5 minutes. Good to meet you. I want to tell you a little bit about my dad. Dr. Irv Schatz was the first physician on the record to question the ethics of the Tuskegee experiments. For years, the United States Public Health Service withheld penicillin from African-American men with syphilis to, quote, study the disease process. And so I'm thinking of my dad when I ask about a statement you made during last HELP hearing questioning the recommended childhood vaccine schedule and implying that these vaccines should be tested in children against a placebo control like a saline shot. I just want you to know this is not a gotcha. I'm hoping that I misunderstand what you're talking about. You know placebos exist, placebo-controlled trials exist in the existing vaccine approval process. Are you suggesting something different than that?
There are placebo-controlled trials, Senator. And by the way, my uncle, Ted Kennedy, in 1975, held the hearings that ended the Tuskegee experiment. And so I'm very, very familiar, and I've met some of the people who actually suffered from that. Under the current vaccine schedule, none of the vaccines, with the exception of COVID, have ever experienced a safety trial pre-licensure that involves an inert placebo. None of them. COVID's the only one. And I don't think that it's ethical to go back and retest those vaccines against a placebo, if that's what you're suggesting.
That's what I'm trying to clarify. And
No. But you know what? The Cochrane collaboration in 2016 published a study that showed that the predictive capacity of placebo-controlled trials, which are the gold standard, is actually not any better than good observational trials and retrospective trials. So we can do those kind of studies without subjecting people to an unethical experiment.
That's all I wanted. This is not a gotcha. I wanted to just clarify that we're not contemplating population-wide studies of. Okay, great.
And they do. Just to clarify, they do have efficacy tests against placebos, but they don't have safety testing.
It's a biological fact that as an Ashkenazi Jew, I'm more likely to carry the Tay-Sachs gene. We know that rural Americans are less likely to receive preventative health services than people who live in cities. We know that liver cancer is more than twice as common among Asian Americans than white Americans. I just want to clarify, as the administration attempts to root out what they consider to be DEI, that we are not characterizing biological differences between the sexes, among races, among people who live in different parts of the country, and the study of those, because obviously in the administration of care, whether it's medicine or other health care, we want to know how different people respond to different courses of treatment or preventative care or whatever it is. I'm assuming you don't think that's DEI. Is that
No,
fair?
absolutely not, Senator. And, you know, I was talking before you got in here that we worked with Senator Tim Scott on a very, very innovative program that we approved 3 weeks ago in South Carolina to deliver a new cell therapy to people, to every person in South Carolina who has sickle cell disease.
Right.
There are
Yes.
all kinds of diseases that affect certain races that have manifest sexual dimorphism, and that's nothing to do with DEI.
Okay, so I think the challenge is, and this is not just your agency, but really government-wide, is that the first cut at eliminating, scrutinizing, freezing, reforming grants, projects, lines of funding has been this basically sophisticated version of Control F, where you look for the word gender, or you look for the word race, or you look for the word equity. And I would just ask you to relook through your departments at whether or not some of this stuff got swept up accidentally, and it's not some PowerPoint presentation to your workforce to divide them according to race and tell people what words to use to describe themselves or others, but rather a kind of foundational aspect of medical research. And I just would like to be reassured that you're taking a second look after the kind of first Doge script was written to flag anything that could be problematic from the standpoint of the Trump administration.
We are doing that, and we've already rectified a number of studies that were eliminated based upon those presumptions because they fit because the search terms made them look like they were DEI. And when that happens, people call me, and I call Jay Bhattacharya, and I say, will you take another look at this? And in several cases, he's reinstated them. We do not want to lose that kind of science.
Thank you.
Thank you. Thank you, Senator. Senator Baldwin's going to make a quick statement, and then I'll wrap it up.
Yeah, Secretary Kennedy, I do want to make sure that we correct the record on the lead program that we've been discussing back and forth last week in this. There are no staff on the ground deployed to Milwaukee to address the lead exposure of children in schools, and there are no staff left in that office at CDC because they have all been fired. I look forward to working with you to reestablish that. It sounds like you have a commitment to that, but we need staff in order to make it function. I do have some further questions for the record, and understand that we will have an ability to submit those.
Yeah. So this ends our hearing today. I really thank you and my fellow committee members. You had full attendance today, so you're a popular guy, but a very thoughtful conversation, and thank you to Secretary Kennedy. For any senators who wish to ask additional questions for the record will be due 1 week after the full budget request is released. The hearing record will also remain open until then. For members who wish to submit additional materials for the record, the subcommittee will stand in recess, and thank you.
Thank you, Chairwoman Capito. And thank you, Senator Baldwin.